Bolsonaro spoke of not catching it, and he caught it. It's not just a little flu, like he was talking about.
This was the fourth test Jair Bolsonaro had taken for COVID-19. He had a scare early on in the crisis when he paid a visit to Donald Trump, and several members of his presidential team fell ill. The US president took a test shortly afterwards. The two men have much in common, playing down the virus and leading countries that are now suffering the most.
We're joined now by Leticia Kawano Dourado, a pulmonologist and researcher at the Hospital de Coração in São Paulo. When he spoke today, he was wearing a mask. He didn't seem embarrassed about what he'd said before. Indeed, he was saying that he'd already had a positive, there'd been a positive impact from hydroxychloroquine. How do you think he's going to play this? I mean, he's in a vulnerable age group, isn't he?
Yes, he's a vulnerable age group, but he's like using that as his strategy to sell out hydroxychloroquine. So he just recorded a video for Brazilians saying that he's feeling perfect, he's doing very well. And that's probably because he's taking hydroxychloroquine since the beginning of the COVID-19, of his COVID-19.
You've done some research into this, though, and what did that research tell you?
So what Bolsonaro, since the beginning, has been advocating against social distancing measures, against the use of masks in public, and he's using now this episode of his COVID-19 sickness just to prove him right. And he will probably succeed because, as we know, COVID-19 for the majority of people will only be mild illness and will not take most of the people to the hospital. So if that happens with Bolsonaro, which is expected in terms of probability, he will be able to attribute this effect to hydroxychloroquine as a case report that he's using.
Just tell us if you can. I mean, with so many thousands of people who've died from this now, how is Brazil coping? How is the infrastructure coping with this? The hospitals? Which age groups are affected? Are people dying at home or are people dying in hospital?
So what is interesting here in Brazil is that except in the beginning of the pandemic, where we had two hotspots, which was Manaus, the city of Manaus and city of Belém, we haven't had really hotspots where the healthcare system is really burdened. So all these deaths are all spread out through the country. So for example, here in São Paulo, I am from São Paulo, the cases, they don't stop coming to the hospital, but at the same time, we are not like reaching our limit. So that's the reason why I see many local authorities agreeing on relaxing the social distancing measures, but I don't think it's a good idea, though.
No. All right. Well, let's hope things improve. Leticia Kawano Dourado, thank you very much indeed for joining us here on BBC News.